Well, greetings and welcome everybody to this great event. Thanks for joining us today. I am so pleased as president of the American Physical Therapy Association to express our association's great support. And I do that on behalf of our board of directors, our great staff, and our over 80,000 members who are equally as excited about the effort that the Illinois chapter is undertaking here. It is wonderful to have colleagues so excited about such an important issue as direct access and the improvement of access to our patients to our care. I want to begin, first of all, by acknowledging and thanking Representative Angelo Skip Saviano, who couldn't be with us today, but there will be a statement read by him later, for sponsoring this important legislation, the Illinois House Bill 4478. This important new legislation would give the public direct access to physical therapy in the state of Illinois. In other words, it will give what they deserve, the right to access the services of a licensed physical therapist without having to first secure a prescription or a referral from a physician. How important is that? How important is it? Okay, that's what I want to hear. This is the same access that healthcare customers and consumers, our patients and clients in most states currently enjoy and have, and in some cases have enjoyed for 20 and 30 and even 50 years in a few states. It's time that the citizens of Illinois are given that same access to our great care. And because we as a profession have been able to see this policy in action in other states for such a long time, we know a few things to be true. First, direct access is safe. A leading provider of liability coverage for physical therapists has stated repeatedly and continues to do so that over these years, they do not adjust their premiums based on whether a physical therapist is located in a state with direct access. That means something. That's a truth. The Federation of State Boards of Physical Therapy, the organization that represents state boards and agencies charged with licensing physical therapists and protecting the public from harmful practice, has also noted that in states where there is direct access, there is no increase in disciplinary actions against physical therapists. Now, our opposition might employ lots of scare tactics, and one of them is that this is not safe for the public. I've just given you two reasons to tell them very directly that's a falsehood. Tell them. The second thing you need to pay attention to is that direct access saves money for patients, for employers, for government, and for insurers. Over the past 20 years, studies have consistently demonstrated the potential for cost savings to healthcare systems when they allow direct access of their consumers to physical therapy services. And in fact, such a study was just published in September of 2011 in the Journal of Health Services Research by researchers at Des Moines University. And they reviewed more than 60,000 episodes of physical therapy in Iowa and South Dakota, states that have allowed direct access to physical therapists for more than 20 years. And they discovered that the average cost for physical therapy claims was lower for patients who visited a physical therapist directly. The average cost was $347 for patients who saw their PT directly compared to $420 on average for those who were referred by a physician first. This is an important fact because not only do our opposers claim a lack of safety, but they also claim the fact that it will be more expensive in the long run. These researchers also found that patients who visited a physical therapist directly for outpatient care, not only did it cost less, but they had fewer visits on average than those who were referred by a physician. And the removal of a physician gatekeeper did not lead to overuse of care. Those are facts. Finally, and importantly, and I almost have to feel like I should say most importantly, but those are important facts too, direct access is it's not about ensuring our future. It is about ensuring that patients are able to access and choose the physical therapy care they need when they need it, without barriers like inappropriate referral requirements and restrictions. And we know that patients often face obstacles to obtaining a physician's referral or prescription for our services. They have to schedule an appointment, which can potentially extend their wait by weeks. They have to take time out of their day to do that and possibly travel a significant distance to get that referral. Are they seen sometimes for the referral? No, they're not. Sometimes they get them simply by calls. Does that make sense? Not necessarily. They might have to pay out of pocket to get that referral. Their insurance might have to pay extra. They might have to pay a copay for that referral. These are additional costs. Number one, that they shouldn't have to pay, but number two, many of them cannot further afford to pay. All for the purpose of obtaining simply a piece of paper from a physician telling the patient what they already know, that they need a physical therapist. And all of these delays pose unnecessary burdens to these patients that can have a very real impact on time to care. We know the sooner they have access to us, the better the ultimate outcome of our care. So timely access to physical therapy is critical, we know, in restoring patients to optimum function, independence, and regaining the appropriate movement that they require. By removing barriers and onerous requirements like unnecessary referrals, this House Bill 4478 will improve timely delivery of services, diminish the impact of disease on disability, and promote earlier return to prior functional levels. And it will do so in a safe manner that can also save very valuable healthcare dollars. I thank you for being here today. I thank the Illinois chapter for its steadfastness in moving ahead with this important issue, and would like to now turn the time over to Patty Naylor, who is representing the profession in Illinois on this very critical issue. Thanks for giving me a chance to talk to you about this.